Hello, I created these videos because I realized that a lot of my patients did not have the knowledge of the common neurological disorders affecting them. They did not have the knowledge and they did not know where to look for this knowledge. In the digital age that we are in now, I find YouTube an excellent platform to keep abreast of various information. I myself have learned many things about personal finance, investing, and technology in YouTube. In return, I hope that you will derive benefit from learning about common neurological disorders. If these are the kind of content that may interest you, do consider subscribing to this channel so that you may get the latest advances in the diagnosis and treatment of common neurological disorders. So let's begin. Today I'm going to talk to you about stroke. There are two types of stroke: ischemic stroke and hemorrhagic stroke. Ischemic stroke is caused by blockage of one of the blood vessels of the brain. Hemorrhagic stroke is caused by bleeding into the brain or bleeding around the brain. Now it's important for you to recognize the symptoms of a stroke so that you or your loved ones may come to the hospital as soon as possible. What are the symptoms of a stroke? Now you need to remember the words be fast, BEFAST, where B stands for balance, or rather loss of balance, or dizziness, or unsteady in walking, which occurs suddenly. E stands for eye, sudden loss of vision in one eye. F stands for face, sudden drooping of one side of the face, typically involving the lower part of the face, either the right side or the left side. So there's a sudden drooping. A stands for arm, sudden weakness or numbness of the arm or the leg on one side. S stands for speech, sudden slurring of speech or difficulty understanding speech or difficulty talking. And T stands for time to call 911 and time to come to the hospital. Now, why do I stress all these symptoms? Because stroke is a very time-sensitive disease. The faster you come to the hospital, the better your chances of recovery. The sooner the medication is given to you, the better the chances of recovery. Now, what is the treatment of a stroke? So, if it's determined that you have an ischemic stroke, certain medications can be given intravenously, and this medication can dissolve the blood clot in the brain that is causing the stroke symptoms. In some other cases of an ischemic stroke, a procedure called an endovascular thrombectomy can be done. Now, in an endovascular thrombectomy, a catheter is inserted through the groin or through the arm at the wrist, and this catheter is advanced until it reaches the blood vessels of the brain, and then a stent retriever is introduced through the catheter and guided all the way to the blood clot in the brain. And this stent retriever removes the blood clot from the brain, hence restoring blood flow, and the symptoms may go away. So these two treatments, that is intravenous medication to dissolve the blood clot, as well as endovascular thrombectomy, is done in a case of an ischemic stroke. Now, what do you do in a case of a hemorrhagic stroke? In certain cases of a hemorrhagic stroke, minimally invasive surgery can be done to remove the blood clot. Not in all cases, in certain cases only. Now, how do we determine whether you have an ischemic stroke or a hemorrhagic stroke? This is determined by doing a CT scan when you come as soon as possible to the hospital and to the emergency room. I do hope you like the content of this video. Thanks for watching, and I'll see you next time.